Very good, thanks. Okay, so I was prescribed, but not really cheap ideas either, so I'll just read stuff out, and if I've forgotten, jump in and start yelling. Okay, so we'll start off by talking about an idea that brought up, saying that we should be aligning the goals of the different actors when we're talking about designing the healthcare system. And those different actors being the healthcare professionals, the patients, and the administration. Scoring goals there. And the issues or the flaws that was pointed out is that traditionally the healthcare systems don't distribute data properly, and they don't take into account the important central role of the patient themselves. And everybody's got different perspectives. So that was you talking about that. The professional medicals, the admin, they're always talking about lower cost, and patients are like, no, not lower cost, best care. And they want to present new perspectives to the healthcare system. What?
Good.
Thanks. New glamorous assistant.
Yes.
Good one off with it.
See how easy it is as well.
Okay, so we're talking about how conflicts may arise in the redesign of the system between the patients, healthcare professionals, and the admin. And the problem is cost. So at the moment, organising, financing, and providing care is currently unsustainable in healthcare systems all over the world. NHS, definitely the NHS. So then we were saying, could social media reduce the cost? And reduce the cost by promoting self-care, which is currently what the NHS is all over. And also, could social media reduce costs by reducing error and disorganisation? Those are the questions we asked. And then somebody made the point that they reckon the public wasn't currently being engaged in the changes to the healthcare system when it's being redesigned or as it evolves. And also the kind of paradox / problem of self-care makes people make more choices because they're empowered and they know what they want. And then that in turn puts more pressure on the system, kind of, because even though they might be caring for themselves better, they might know that they want this expensive drug and they might demand it. So there you go. The other thing about self-care is that people have a choice to not care and have these unhealthy lifestyles. That's a burger, it's a pint. And then that impacts on the healthcare system. And then we were talking about social design of care, which is kind of like our buzz phrase. We like it. And that the healthcare system should be designed around lifestyle choices. Because we were saying, like, how well do we actually self-manage when if you go to a hospital on a Friday night, you are likely to see somebody not very well because they've had too much stress.
I've apologised for that.
Again.
Yes, I've more than once.
And then we're saying, can social media improve patient education? We're nearly there, guys.
You're doing great.
Thanks. And then we did this cool thing where the healthcare system becomes social design of care. Yeah. And we were talking about different channels, multiple opportunities, and different technologies to create this transition. And helping people to face what they don't want to hear from diagnosis. So that's another kind of problem with education. Sometimes people don't want to know what's wrong with them, and they don't want to know where they might end up several years down the line. So it's about focusing the knowledge and having a slow and relevant release of information to the patient themselves, and also educate with understanding, so kind of getting what a 17-year-old might want to hear about his diagnosis of diabetes and what's relevant for him as opposed to what's relevant for a 38-year-old. And we were talking about how the way that people digest the information has changed. So Twitter, it's not just a massive glut of information on one page, but it's feeds, little bits, little bite-sized bits of information, and you choose what you get and who you follow. The end.
Great. Personally, I love this one better than Andrew. Actually, since we have a competition.
Well, I like to think I'm encouraging art, not stifling
Yeah,
it.
you were my inspiration.
I like you.
Do we have a prize then?
You see one?
There's several pieces of paper to get there.
See, Andy has this deep psychic scar because he never got on Vision On as a kid.
But he did get Blue Peter Badger. Blue Peter. For drawing.
That was a great session, wasn't it?
Yes, yeah.
Thank you all very much for your contribution. So, this is where the structured element of today's activities ends. So, could all crash and burn now? No, horribly wrong. In which case, we'll go to the spotted dog. But otherwise, we will see shortly what the world has asked us. If you can hang on, world, we haven't actually factored in a comfort break. We call it going to the loo over here, but we're going to take 10 minutes, I think, if that's okay, because rather than just head straight into this. So we'll break.